Why most doctors brush off pregnancy nutrition. Sit with me for a few minutes and I will tell you why your doctor's pregnancy nutrition advice is all wrong. Now, if you are interested in it, I also want to offer you my 7-day pregnancy nutrient power plan. Just drop me a comment below and I will send that to you. It will help you get your pregnancy diet on track in just a few days. But right now, if you don't know me, my name is Kristen and I am a pregnancy coach who works with moms all over the world. I've had 8 babies naturally myself and I love helping mamas have a healthy pregnancy and prepare for an awesome natural birth. Each day I'm bringing you one actionable tip that will help you give your baby a beautiful beginning. Like I said, today I want to talk to you about why your doctor's pregnancy nutrition advice is all wrong. Now, this really isn't something that means that your doctor is ignorant or stupid or anything like that. I'm not against your doctor or your midwife, but the fact is most of them are not taught anything about pregnancy nutrition, and this is especially true in medical schools. It's just like with general practitioners. They're taught about disease, but not necessarily about prevention, and even when they're taught about prevention, what they learn about nutrition is really only cursory. And when you look at the model of obstetrics, which is the baby having branch of medicine, what they're really looking at, obstetricians are surgeons. And so what they're learning about is how to do surgery, and they're learning how to help moms who have complications, but they're not really learning how to prevent those complications. In fact, they're looking at it like it's a pathology, like there's a problem. Pregnancy is seen as a disease, when actually it's a totally awesome, natural, and wonderful part of a woman's life, and your body was made for it. So doctors are in this kind of fix-it mindset. They're not in a prevent-it mindset. But pregnancy isn't a broken state. It does, however, change your physiology in many important ways. And that doesn't mean that you're broken or that something's wrong. But what's important for us is to understand what's going on. So in pregnancy, one of the big things that happens, for example, is that your blood supply expands dramatically. And how does that maintain? Like, how do we keep an expanded blood supply? It's through nutrition. What you eat, how you eat, the quality of foods you eat, the nutrients that you're getting, all of those help your blood supply stay maintained. And the reason why I shared that first is because when you have a properly expanded blood supply, you get all of the nutrients that you need circulating around in your body to your baby, right? And that's the important thing. You want to build a baby. You want a healthy baby. You want a healthy placenta to nourish a healthy baby. And you want a healthy uterus to carry your baby and to keep your baby safe and secure. And then also a healthy uterus to help you when you're birthing your baby. You want to have a smooth, efficient birthing time. And you want to know that you and your baby are safe. You want to know that at the end of the birth, everything's going to work perfectly, so there's not a lot of bleeding. And the way that we do this is by understanding that physiology of pregnancy and birth and how we take care of ourselves as pregnant moms. So again, your doctor doesn't know a lot about nutrition, and he probably isn't paying much attention to the fact that many of these things that he's scared of and that you're scared of, like preeclampsia, like postpartum hemorrhage, like babies who aren't growing, that's called fetal growth restriction or intrauterine growth retardation, like low amniotic fluid, like gestational diabetes, all of these things are things that can be prevented if you're eating well during pregnancy. So that is a key. And remember, when you come from this point of view that all of that can be prevented, in other words, you have the power right now in your pregnancy to keep yourself healthy and low risk and to grow a really healthy baby, then you have a huge advantage. Like I said, I would love to send you my 7-day pregnancy nutrient power plan. It will help you start to figure this out and baby step into greater health for you and your baby right now. Just drop a line below and I will be back tomorrow to talk with you about another tip.